This is Dr. Thomas Lamperti. Today I'm going to talk about how we carve a double-wide spreader graft. We'll start with a portion of harvested septal cartilage that we previously harvested during the case to straighten the septum. We have a nice straight piece, as you can see. And now I'm going ahead to cut two strips from the septum to form the spreader graft. The standard spreader graft involves just one piece of cartilage, but in today's patient he had quite a bit of unilateral pinching or collapse in the middle third of his nose, and I felt that in order to really correct this, we would need a portion of spreader cartilage that was wider than what the septum itself would allow. To overcome this, what I'll do is laminate or use a double-wide spreader graft technique. What I'm doing here is securing the two pieces of cartilage together using suture. The suture is actually dissolvable, and in a few months, when it's no longer around, the cartilage would have scarred to itself sufficiently that it'll be quite stable. The graft is also sewn into the nose itself so that it's secured to the upper lateral cartilages and septum. Once we've completed suturing, we'll cut the ends and then proceed with trimming and carving the double-wide graft now. It's mainly involved tapering the ends so that they integrate well with the bones above and then the nasal tip cartilages below. I'll typically place the upper end of the spreader graft right between the nasal bones and septum to allow the bones to help hide and obscure this transition point. Now you'll be able to see the final shape of the double-wide graft, and I do fashion the shape based off of the level of pinching and the ultimate level of collapse the patient has.